vaccination sites. Again, HoustonHealth.org or call 832-393-4220.
Thank you for that information. We'll be asking you a few other questions as we go along. And Ms. Montgomery as well, I know you want to talk a little bit about the hospitals and where we stand with that.
Absolutely. Thank you so much. And I echo the other panelists, want to thank the NAACP for having us on this evening, as this is a much needed conversation to be had. So on behalf of Houston Methodist, I'll talk a few moments just about where we currently stand and what our numbers are looking like, and then also talk a bit about the vaccine efforts. So as of today, right now, we have 700 patients in our hospitals with COVID-19 right now. Last week, we had 800. So that is down from what we've seen. You know, we see glimmers of hope, but I do echo Dr. Purse's comments. We are not out of the woods yet. We start to see some glimmers of hope, and we have seen some days where we've seen steady declines. And then we also get to a point where it just stays. And then we don't see the declines, you know, as we were seeing previously, and it's not going down as rapidly as we would like it to see. So by far, there still is a lot of work to do. We are certainly not out of the woods. In fact, we just admitted our 30,000th COVID patient since the onset of this pandemic. 30,000 patients have now been admitted in our hospital, you know, because of COVID-19 or with COVID-19. And so that's an astounding number, you know, for one healthcare organization. And so one we wish was not as high. In terms of our vaccine efforts, we are also actively, similar to the city, really partnering to try to get our community vaccinated, not just our patients, but our community as a whole. We do have 7 different vaccine clinics across the city that also are available. Patients are able to go to our website and schedule directly. We also take walk-ins at all of our locations, and we really try to make it convenient for patients to come in and get vaccinated. Over the past 2 years, we've also had many community efforts and really tried to partner to not only bring people to our sites to get vaccinated, but also go out into the community where there are the greatest needs. We actually have targeted the communities that have the higher percentages of poverty, higher percentage of racial ethnicities, and we've gone out into those communities to offer vaccines and to try to educate the community on the safety and effectiveness of vaccines, and really try to help people get over the fear factor and the misinformation that is out there. I'm very happy to say that we have administered nearly 1.1 million vaccines to date, total number of vaccines, and the number continues to go up. And so it's something, again, I echo all the previous comments. We want to see more children vaccinated. We want more people to get boosters. We are seeing, as I look at our hospital data and the admissions that we have over the past month, 3/4 of the patients in the hospital with COVID now don't have a booster. So it's no longer just a matter of, you know, I got my first dose or my second dose, especially now with the Omicron variant. The booster is really the difference in what we're seeing in terms of the hospitalization. So I just can't stress that enough for people to come out and get vaccinated.
All right, thanks so much. Well, I'm going to just be asking some of the questions that some of you have already submitted. Some of you are submitting in the question in our live chat. Others have submitted questions before the panel, and we'll just kind of rapid fire through these so we can get through some of them, the ones that are being asked the most. I guess I'll start with you, Dr. Purse. You know, a couple of folks have asked, okay, if you're vaccinated and you get COVID-19, are you safe to just recover at home? Do you need to go to the doctor, to the hospital? What do you do if you get COVID?
So if you get COVID and you get the symptoms, the first thing to do is to get tested to make sure that you know what you're dealing with. There are other illnesses out there that could mimic it, and right now, Dr. Gath mentioned, we are starting to see some flu in the community. The numbers are really low. We're looking for that in the wastewater too, but it is coming in. We, as he pointed out, we traditionally peak in February or March. So you want to make sure you know what you're dealing with, especially if you're somebody who has other medical illnesses. And then you want to make sure that your primary care provider knows if you test positive, they know what's going on. Perhaps you're going to be eligible for one of the therapeutics that Dr. Gath talked about. If you've got complicated medical problems, you may be somebody who we would want to get you, treated ahead of time once you test positive. And he pointed out the time crunch that you can be under. If you have no other medical problems, perhaps you don't have a doctor, you need to probably, I would avoid going to the emergency department. It's probably one thing I would tell you not to do. But otherwise, reach out. Harris Health has a lot of opportunities for people to get in touch, get a healthcare provider. There are ways that you can get healthcare providers. And rest assured that for the most part, most people are doing well. But if you are getting sick with a capital S, and you will know what that means because you will be the one experiencing it, don't wait and think that you can tough it out, because it's like a forest fire. The fire is easy to put out if we get it early. It's the same thing with illness. It's easier to successfully treat a patient if we get them early than if we get them late.
All right, thank you for that. A lot of folks have also had questions. I'll take this to you, Dr. Gath, about PCR tests, rapid tests. Which one is important for me to get if I get COVID, or if I feel like I have symptoms? Is one of them better than the other? Lots of questions about testing.
So the testing, I tried to mention a little bit, the PCR testing is the most convenient to do. And that's the one that I would start off with, but you have to interpret it with a level of understanding, because the PCR test has more, the rapid test has more false negatives than the PCR test, but that's the easiest one to get. The kits are available. You can get them from the government. We'll have the website up, you can get them. I would start with that. If it is negative, but you've been exposed and you still feel like you have COVID, you simply need to repeat it and treat yourself like you have COVID. The PCR test is often necessary for going back to work sometimes, or traveling and things like that. That's the nasal swab test where you have to actually go and get that test done. It is more accurate because we'll pick up COVID more routinely, but also it may stay positive even if you're not infectious or transmitting the disease. And so I would say the answer to the question is the easiest thing is to start with the rapid, see what you get, talk to your physician about what it means, and then move to the PCR if there's more questions that are necessary from there.
Okay, good. I'm looking at some of the questions in the chat. This one, I'll see if we can pull it up. This person said, COVID-19 is being measured in public water sources by the health department. Why, if the virus is airborne? Is the city's water safe for general use? Does anybody want to talk about that? Is the city's water safe? And why are we measuring the water sources?
Yeah, I'll take that one. So two completely different water systems. The water you drink is the city makes that water, purifies it and gives it to you. So drinking water is completely safe. It's a completely different system. We're talking about the wastewater system. So this is when you flush your toilet, that's where that goes. It's a completely different system. And the reason we test is, like I said earlier, people who are infected with COVID will pass it in their stool. And so we can test for it. And we are testing for the levels, right? So we're testing at the wastewater treatment plants. The city has 39 different wastewater treatment plants supporting a community, about 2.3 million people. And so we can sort of get a gauge as to which way the viral activity across the entire community. Is it getting worse? Is there more virus? Are we finding more? Or is it going down? But to be specific, the wastewater has nothing to do with your drinking water. Your drinking water is completely safe.
Thank you, Dr. Peirce. There have also been some questions. This person says there have been some confusing statements when it comes to isolation. How much time is required to isolate if you have COVID with no symptoms, and if you recover from COVID with symptoms? So just talk a little bit, if anyone wants to, about the isolation, what's necessary.
So current state, the recommendation for isolation is 5 days. If you don't have any symptoms, if you're asymptomatic and you test positive for COVID, you are to isolate for 5 full days after your test result. And then on the 6th day, you are able to then resume normal activities, but absolutely mask with an N95 or KN95 going out in public. So that's the current guidelines for that. If you are symptomatic, it's still 5 days, but there's a few disclaimers to that. So it's still 5 full days, starting from the time your symptoms begin, and you isolate for 5 full days, and then you're able to resume and go back out on your 6th day, as long as your symptoms are resolving. These were mild symptoms. They're resolving, and you've been fever-free for at least 24 hours without taking any medication to help with that. And again, going back out with your KN95 or N95 mask. And then if you're having severe symptoms, if you have a severe symptoms throughout your course, and you get to that, day 6, I would say don't go out in public. If you're not getting better, definitely that's when you see a provider. And there's many options. We have virtual providers. You can see virtual urgent care. There's many different options that you can take than to just seek the advice from a doctor before going out if you're having symptoms still.
Awesome. I want to also welcome someone else who's joining us today. DJ Kiati Brown is joining us. He is up there. He's, I believe, also working at a Rockets game, but he's been pumping up this panel all week, and I know his listeners, a lot of them are on right now watching this. So I know, Kiati, you've been hearing from your listeners at 93.7. What are they asking you? What are some of the questions they have for our panelists?
First and foremost, pleasure to be here with you, brothers and sisters. It really was important for me to stop a Rockets game to really come sit down to address this again. Mayor, as you can see, I'm masked up. They make us do the games with masks on. For me, that mask is actually what I was getting the most questions about. I guess whenever the new strand came, the messaging switched from wearing a cloth mask like this to, okay, if you can now wear a N95 or a KN95, and some of the people were just like, well, what is the difference? And is my little mask still good, or now I need to go and upgrade and buy more masks? So it was just confusion about, they already was feeling a certain kind of way. I think they're going through COVID fatigue, a lot of us, just after this long period of time, and now you want me to upgrade my face protection? So a lot of them were asking me questions like that. Is there a reason why the messaging changed as far as the type of mask that we should wear?
So
You take that, Dr. Purse or Dr. Gath?
Either way, we can all comment on that. I think the first thing is what I said. There's a lot of things we don't know when this particular epidemic started, and it changes over time. When this first started, there were not enough KN95s and N95s for the doctors to wear when we're sitting in the middle of the COVID unit. And so they weren't around. I had to wear one mask for 7 to 10 days because there wasn't enough masks floating around. And so ideally, it would have been nice to have everyone have that, but we didn't have that then. The good news is that particular variant wasn't as transmissible as the one we have now. What we're realizing now that Omicron has changed its spots, has become much more transmissible, and it can get around the cloth mask. It can get around masks that slip down past your nose or not fitting tight. So that's why it's important with this variant to have the KN95 or the N95 mask. And the good news is the government is going to be providing them for free. The city is going to be helping us, making sure people have access to it. And when you're in a place like the Rockets game, where there's a lot of people around you, that's when you need to have it. You need to have it when you're walking in the park or jogging and nobody's around you, no, but you need to wear it until this particular strain of the virus goes away. It's very, very important that one of those two masks are used. And it changed because the virus changed, and our ability to give what people need to have is also changed.
That was the other question, and you kind of said it before I said it. I'm glad you said that. That was what we call the alley-oop live from the Rockets game. Listen here. Yeah. The other question was for people like me that I move around a lot, I do a lot, right? I don't know if I'm supposed to ask this question, but how many times can you wear a mask, brother? Because you said like at that point, I'm just asking, I'm outside. But
that's a very good question.
How long can you wear a mask until it's like, all right, let me not wear this mask no more?
That's a very good question. So this is the KN95 that I mask wear. I usually have it around nobody's here but me. So I usually have it around my neck, just like this. And when it's time to go somewhere, I pull it up and pull it back down. You can use this mask until it sort of doesn't feel too good anymore. You can't wash it. And there's not unlimited supply. So it depends on how many hours a day you have to wear it. If you're just going out to the store and you're on it for 30 or 40 minutes, you can probably use this mask for a while. The government is going to give you 3 masks. My suggestions are to have a Monday mask, a Tuesday mask, and a Wednesday mask, and alternate them. Use the Monday, Tuesday, Wednesday, use the Monday for Thursday, and use them until they sort of don't feel too good anymore if you don't have access to any more. Just how many hours you have to wear it. I have to go through one a day because I have it several hours a day. But I pull them up when I'm walking out, going to get gas on the way home. I'm gonna put it on. I'm gonna pull it back down and that kind of thing. And you need to do what you do for a living. You need to do the same thing and have a good KN95 and use it until it just doesn't feel like it works more. Can't wash them. because that gets rid of what you're trying to do. You can't do that, unfortunately. And keep them out in the sun and dry after you've used them and go from there.
Okay, they had a lot of questions. I just had 3. This is my last and final question. And I hope it's a good one. Here you go, y'all. Wait, let me take my hat off. All right, here we go. 3rd question. For us, we starting to see stories in the news saying that the numbers are going down, and for the people that are COVID fatigued, is there any timeline to when we can get back to normal, regular? I ain't gonna lie, I'm a germaphobe. I've been wearing a mask long before this COVID-19, you hear me? But when can we get back to like our regularly scheduled? Because you see reports coming out about the numbers are going down in certain cases, and we hear terms like herd immunity and different things like that. At what point can we, is there a timeline of where we can get back to our regular scheduled programs?
All right, I'll be foolish enough to take a stab at that. And one of the things I've been saying recently is that if I want to make a mistake, I make a prediction. So, and I think that what we'll see is if we look at the waves that we've had before, they peak and they come down and then they stay down. They sort of slowly come down and they sort of plateau out, and we can get a couple months out of that. Is what we've seen in the past before something changes, right? And then so the last couple of times it's been a new variant. So barring a new variant, I'm kind of looking forward to the rodeo, as the mayor pointed out earlier. I'm looking forward to us having a quite successful rodeo because the timing looks like it may work out just perfect for that. But if we get a new variant, then we're kind of back at square one again. And so what I can tell you is that our wastewater is going down. That is a very reliable predictor for the next 2 weeks. So I think for the next 2 weeks, I'm very comfortable saying things will continue to improve. And then after that, barring a new variant, I expect the same. But again, this virus, it breaks every rule we've ever seen viruses normally adhere to.
Dr. Price.
The antidote to COVID fatigue is vaccination. The more we vaccinate, the quicker we out of this period.
That's right. We've also been getting a lot of questions about children and how can I keep my child safe at school? Obviously vaccines, Dr. Gath, a big part of that for those who are eligible, but anyone want to talk any more in detail about how we can protect our children?
I'll start, and then certainly the other panelists can chime in. With children, it is hard, especially with young children, if we could just be completely honest. Just they pass germs and everything so easily, even before the pandemic. So that's the reality with kids. When we send them to school, though, I think the safest thing we can do, make sure your kids are masked, even if the schools don't require them. Some school districts are, some are not. And so it varies. And so I would say just make sure your children that they wear masks, teach them proper hand hygiene, and about not touching their face and what have you. And I think that's really some of the things. It's just down to the basics: stay masked, hand hygiene, and really and get them vaccinated. If we have a choice to that, if we have children, make sure that they're vaccinated and take them if they're 5 and older.
Jonathan, I want to add to that, please. This is Congresswoman Jackson Lee. I think the numbers that I offered at the very beginning evidences that we have a real challenge with getting children vaccinated. And I think we have a need of a real commitment to raise the ante and to raise the effort on convincing parents that vaccinations help and they don't hurt. And I can understand how children would be concerned, families would be concerned that the vaccination hurts children. And over again, we have to be able to say, one, children are resilient. And since I've been around a lot of children at these vaccination sites, because we focused on children and the testing site, in a minute of being vaccinated and the time they have to sit and rest, they're up playing. So if we can give comfort to parents that one, parents, you should get vaccinated and get your booster, but your children will be the better for it. The mask, I totally agree. And I think that once you tell little ones to wear the mask, they can make a game of it, and they do keep it on. I think hygiene is something that you have to really teach them. But I have 6-year-old grandchildren who insist on wearing their masks. So they get it. And I just think we have to make a huge effort to get these numbers up from 13% and 18%. If there's another surge, we're going to see children in hospitals, particularly Texas Children's Hospital. We have headlines whether that's the children in hospitals are outpacing the vaccination. So parents, if you're on, my loving challenge to you is please get your children vaccinated. I know you can get them tested, but get them vaccinated and have a fun game. There are children in 95s and KN95s, and you can look at them. We're going to be sending masks from the nation. The federal government is going to be providing you with masks. And so you're going to be able to get them everywhere. And there should be child-sized masks that are K95 or KN95. Please, if you do it, we can see a fun summer coming up for you and your family.
That's what we want, Congresswoman, a fun summer.
We got this question in our chat. Someone saying women of color have higher mortality rates. Are COVID-19 vaccines recommended for pregnant women? And also, is the Pfizer preferred over Moderna for pregnant women? Can anyone answer that?
So I would say that I won't comment on Pfizer being recommended over Moderna in pregnant women, but what I can say is we definitely recommend pregnant women to get vaccinated with Pfizer or Moderna. Again, it's to stop the risk of being infected and to spread and from spreading the disease. There have been studies, from the studies that have been done, it's been no evidence that the vaccines cause increased miscarriages and some of the other myths that we hear out there. It has been proven to be safe for pregnant women. Many pregnant women have been vaccinated and, it has been proven to be safe. And so we do encourage all pregnant women to get vaccinated, and we have been vaccinating them here at Houston Methodist.
Question for anyone who wants to answer this. How would you address, this is coming from Charles, one of our folks who sent in a question, how would you address an individual who is completely against getting any of the COVID vaccines? I'm noticing this with so many young adults, and I can be honest and say I have a younger brother who is in that category. You just want to, what do you say? What do you do? Because some people are just against the vaccine for various reasons.
I'll take that because I've been at a number of our vaccination sites and have actually confronted individuals that were not open to taking the vaccine. I think that first you try to connect with them at the level that they're presenting at. Make your best case. I think Dr. Gath presented some very good information that you can share. But at the end of the day, I think we have to recognize that it is their choice. And so if they're still at that point, then you would want to stress the use of masks so that they can protect themselves. And I looked at the question, the age group that they mentioned are really the age group that we're challenged with across the city and community when it comes to being unvaccinated and not willing to take vaccinations.
And Jonathan, I'll add to that, not from the perspective of a medical professional, but being at the sites as well. You need validators that they believe in. In the instance of the family that I spoke to, they were not young men and women, but they were children and a mother. And we sat with a principal, since we're out of school, the principal, who's a real strong figure in the minds of little ones who were afraid not to take it, but they're afraid of the pain of the needle. And then we gave the mother a emergency paramedic and registered nurse and spoke to her for a period of time and got her to understand that the vaccination is not the one that hurts them or causes them illness. It is not getting them. I think with the young men and women, validators like their fellow either college students and or their fellow travelers who have gotten vaccinated. We have to take this one step at a time, and we need to not give up on any of them. I think it's important, like Stephen said, for them to wear masks, but I'm not going to give up on those of you who are listening, but relatives and friends, on getting vaccinated. Because I think Dr. Gath said it very clearly, and Dr. Peirce, I don't think this pandemic we're going to get on the other side. And when I say that, the coronavirus as a flu virus may be with us, and we may be getting vaccinations normally every year, maybe your coronavirus vaccination time. If that is the case, then you need to make sure people are unafraid of this vaccine and that they will be eager to get it for themselves and those children. Again, I'm reading headlines, hospitalizations are outpacing vaccinations, and that was just 2 days ago with children. Your children can get very sick and they can make grandma sick and they can make the babies under 5 sick. So get vaccinated, please. And let's try to get some validators that they can trust.
Just to quickly add on to that, and I agree with everything that was just spoken. I would say in those conversations with those younger adults or those that are very hesitant, it's also to understanding where they're at and what their fears are, because everyone is coming from it from maybe a different perspective. And I have had to talk to patients at our vaccine sites that were very afraid. And I've also had to talk to my own family members who were against getting the vaccine, that I fortunately have been able to transition and turn them around to get vaccinated. And it wasn't always just one conversation, to the point, to Congresswoman's point, we don't give up. But it was also just understanding what their fear was and why were they hesitant about it, and then giving them the facts to combat that, whatever that fear was. And I think once they hear facts, and then once they see a lot of people that they're connected to get the vaccine, it can sway them over.
Jonathan, let me chime in here very quickly. This is such a robust conversation. For one, Dr. Gath is my doctor. I've got my KN95 mask. And, one of the challenges we have is people want to wear masks that are in style, right? And so I've got my personalized mask, but as Dr. Gath informed me, you can be in style, wear your K95, and then cover it with your fashionable mask. We're stylish people. We like to make fashion statements out of everything. You can do that with your mask, but cover the K95 with your personalized mask. That's important. The second thing is, I think what we need, and we can do this, Dr. Gath, with the NAACP, with this group tonight, and with Letitia, you just got recruited to be the frontline spokesperson to help with this, but a cancel COVID campaign, that's about education, and that's about transforming people's mentalities and mindsets with the right information. And I think we can do that. We can do it, very innovatively. We can have fun with it, but a cancel COVID campaign, and have families that sign up to be a cancel COVID campaign family. Churches sign up to be a cancel COVID campaign church. Schools, cancel COVID campaign school. Hospitals, cancel COVID campaign hospital. And let's brand that throughout our community. It's about education, sharing right information, and ultimately it's COVID cancellation. And I just gave 3 points in the sermon. It's ready for the offering. We can have a cancel COVID campaign throughout this community, every sector engaged, and I think continue to do what we're doing to make the impact. And Jonathan, I think that's where we're going to go. So we don't just have a conversation tonight. We live here with a plan of action.
I agree with that. Bishop. Mayor, I want to bring you into this conversation. Just talking a little bit about kind of piggybacking off what Bishop Dixon said. What more can the city do, or what more can we do to help you get that message out? Because I think sometimes I know right when the pandemic was starting, there was an effort by the city to bring in certain celebrities and certain notable people, younger people in particular, people of color, to encourage people to get tested. At one point, it was wearing masks at one point, and now, of course, it's vaccinated. What more can your office do, and how can we help you?
Well, in terms of, I think Director Williams and Dr. Burst will tell you, in the city of Houston, communities of color are still lagging behind in terms of being vaccinated. That's and we need to do more. Okay, so we need to bring everybody up. Everybody needs to get vaccinated, and everybody needs to be tested, and not just on an infrequent basis. And people hear from us all the time. We do need to bring other voices, to the forefront, voices that people listen to in other areas. we need to bring them to the forefront. Just in your last question about bringing people who have yet to be vaccinated. I know I've been talking with one well-known personality in our city, and who has not gotten vaccinated, and I've been trying to bring him to the forefront. Quite frankly, I went to him and asked him to be one of the voices to help bring people to get vaccinated. He said, man, I hadn't gotten vaccinated myself yet. And I said, what? And he said, no. But recently, he came back and said, look, I will lead one of the efforts now. So it just goes to say, again, we can't give up on anyone. Quite frankly, in many cases, people are waiting to see how we respond to them when we go to them and they do say no. Do we give up on them? Do we walk away? Do we talk about them? So we need more voices. We need more voices. We need more influencers. This what NAACP is doing tonight is a tremendous help to the city of Houston. Jonathan, you taking your time. Is it Dr. Montgomery?
I got promoted tonight. I'm not a doctor, but
good.
I'm a nurse.
Well, good. Nurse, Dr. Montgomery, Dr. Gabb, and Dr. Purse, and Director Williams, the Congresswoman, of course. But this is a tremendous benefit for the people in the city of Houston tonight. And I want to thank the NAACP Bishop. I want to thank you all, Belinda, for bringing this program forward. Now we need to do more of this with other influencers that we have not heard speak on it, but now Bishop Dixon, we need to bring those other influencers. Kiati, who was on here tonight, from the Rockets game, there's persons like him and others, and that will help the city of Houston. But let me thank you. That's why I wanted to kind of stay on and just listen, because this is of significant, very important and very much appreciated. And thanks, Jonathan. You're the best, man. I'm gonna watch you tonight.
Appreciate you, Mayor. Thank you so much. Well, we have about maybe 5 minutes or so left, and I do want to make sure we get everyone in just to kind of offer some final words. Obviously, we could go on and on. There are lots of questions, but there's no way we could get to all of those tonight. So I want to just start with I guess from what I see on my computer. Dr. Gath, you're up first on my screen. I'm just offering maybe a minute final words, advice, or just talking about maybe something tonight that maybe you heard or want to talk about.
I think the final words, I appreciate everyone being here. I'm excited about the panel. What I want to say is we have a tremendous group of people here in Houston leading us. Many cities don't have people speaking one voice. From our congresswoman to the mayor to the city health department, we can finish our own sentences because we're all on the same page, and our agenda is to make sure that the healthcare is delivered and the information is delivered. So it's proud to be part of our team, and we want to make sure that the city understands that our agenda is to make sure that this particular disease goes away. We need everyone to work together. The resources are there. We want to hear from you on our chat rooms. Send the information, tell us what you thought about this program, and let us know what we can do better. And we're going to do more of these to make sure that the information and the resources are available for our community in a fashion that they can understand and have access. We appreciate everyone joining us tonight.
And we appreciate you being the vision and being the force behind making this happen. We couldn't have done it without you. Ms. Montgomery, a few final words.
Yes, I would just again like to thank the NAACP for hosting this and putting this on, and also the mayor and just Congresswoman Sheila and just everyone that's been a part of this. It's been great. What I'd like to end with is just some resources. We've talked about a lot of this already. We've talked a lot about vaccines, and there certainly are a lot of options that you heard from all around the city. But you can visit our website, houstonmethodist.org/COVID. And you can see all the information about vaccine scheduling, boosters, FAQs, treatments that are available. That's all available on our website. I think this slide will be available to you. And then the next slide just shows different provider options. And so we do have a virtual urgent care. Virtual providers are available 7 to 11, 7 days a week, 7 a.m. to 11 p.m., 7 days a week at a very low cost. If you think you have COVID, if you need an order for testing, that you can log on to this website and be evaluated there. In addition to our same day clinics that we have across Houston that actually will see patients face to face that are having COVID symptoms. That's sometimes hard to find now. You know, a lot of places you have to be seen virtually if you're symptomatic, but this is one option if you do need to be seen face to face. But very happy to be a part of this, and I thank you all.
Great resources. Thank you for joining us. Dr. Williams.
I should say thank you for the promotion too, but I'm not so sure it'll be a promotion. I'm not really a doctor, but
Oh, I think it, sorry, I think you had it on
fine.
your title. It said doctor. I was going off of what they gave me.
Oh, I know. That's okay though. I've been called that before. I think that it's important, and someone said this earlier, that we meet people where they are. I think the whole idea of using trusted ambassadors, people who are actually in the communities that we want to influence, is going to make a difference. From the health department's perspective, there are going to be opportunities that we're going to solicit from various community interests to actually get more involved on a daily basis with our outreach efforts. And so just stay tuned for that. But it's really important, I think, to continue to promote continuing vaccination efforts. I think vaccinations will help us get out of this. I know that we're making testing available, but there are still significant numbers of individuals within our communities, particularly the African American community, that are not vaccinated. Our overall vaccination rate for African Americans within the city of Houston is right about 33%. That's 20 percentage points less than any other demographic. And so we really need to come together, as Dr. Gaff said, to make a difference.
We do. Thank you. And Dr. Peirce.
Yeah, well, let me start off by again, thanking Bishop Dixon and everyone on the panel for having me here tonight. And I think, to repeat something Dr. Gass said, is that the answer to this whole thing is through vaccination. My experience in talking to people who don't want to get vaccinated is they kind of fall into one of a couple of camps. Either one, they have a specific question which hasn't been answered. And if you sit down and you talk to them, you answer their specific question, they can then make a decision for themselves. The second group are people who just don't want to be told what to do. And again, if you sit down and have a conversation with them and explain to them that, it's completely up to you to decide what to do. Here's the facts, make a choice. Very often they will make a choice. And then another group is those who won't for some political conviction. Those are the folks I've had the least success with. But the first two groups, there's a lot of folks there that they just need somebody to take the time and talk to them. And that's what's going to lead us out of this. And my last thing will be, well, I think that obviously, those of us here in Houston, we're going to focus on Houston. Let us not forget, this is a global problem. And at some point, we need to recognize that it's the whole world that's in this boat. And, we've got colleagues right here in Houston that are developing vaccines can be used around the globe. But, we're not going to be out of the woods. We're talking about Omicron, and boy, hopefully this will go away. And let's keep in mind that this is a really big global problem. We're going to be dealing with this for quite some time. So we need to be smarter than the virus. Thank you.
All right. And we'll wrap things up. I'll have Congresswoman, you say a couple words, and then Bishop Dixon, and then I guess we'll wrap up from there.
Well, obviously I have my show and tell N95 mask on, and I'll take it off for a moment just to say that all of you are the best. Dr. Gath, you're absolutely right. It is good to have a community of persons, medical professionals, and others who are speaking of one voice. So I can only say that vaccinate, 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 and test, test, test as necessary. And thank you, Stephen, for really highlighting 33% in the African-American community. That is a mountain that we need to climb, and we need to be successful. I may see you in the weekend in some school, some middle school, elementary, high school, or faith institution, and there will be other sites that you can go be tested and vaccinated. Take advantage of it, because that's the way to save lives. All the efforts that Dr. Gath, Dr. Peirce, and other medical professionals, Methodist Hospital are doing, it is doing after the fact when people become either very sick or they become sick enough to see a medical provider. Let's get vaccinated and find a place to bring your children, and as much as you love your children, for all the things you want to give to them and want them to be educated, put them first when it relates to fighting COVID-19, and make sure they get vaccinated, and then make sure they're tested as well. So I look forward to seeing you doing good things and bringing that number up in our community higher than 33% and bringing the overall number in Harris County and Houston to 100%. Thank you to the NAACP, Bishop Dixon, and Yolanda. Thank you so very much. The NAACP always upfront, helping the vulnerable, fighting for social justice. Thank you very much.
All right, thanks so much. And now I have to run to get ready for the 9 p.m. news, but I do want to just thank everyone thank you guys for inviting me, the NAACP, Bishop Dixon, Yolanda, Belinda, Janice, everyone. Thank you all for having me. I'm honored, but I do have to run. So I'll let Bishop Dixon and Dr. Gath close us out.
Thank you very much, Jonathan, and we appreciate you. We know you have to exit. Dr. Gath, thank you so very much for your leadership and bringing us together. And we appreciate having your stupendous insight and all of the professionals, Dr. Purse as well. Thank you so very much. And I'm calling you Dr. Stephen Williams. You know, I'm in the church world. I got the authority to speak things as though they are. Dr. Letitia Montgomery, God bless you. We appreciate the Congresswoman. We appreciate you so very much, as well as Mayor Turner. Thank you, Belinda, Everett, and to the entire Health Committee and Yolanda and all of you. I'll close with this. Dr. Gath, I would love for us to quickly reconvene some of the minds on this panel tonight to really organize a strategic campaign. I think that's what we're lacking right now. The next step is for us to move with a strategic campaign. And, you know, I'm very serious about that. Cancel COVID campaign. We have got to be consistent. We need to do something like this every other week. It doesn't have to be as long, but we can be bringing those other personalities that the mayor talked about together to speak, to get influencers to talk about vaccinations. And we can get entities to do innovative things to bring those numbers up from 33%. That has to be our commitment, and looking forward to doing it. And we appreciate that. And finally, listen to the public. If I was looking for someone to treat my car, I would not talk to a medical doctor. I'd go to a mechanic. If I was looking for someone to fix my air conditioner, I would not go to someone who plays golf. Too many of us are still listening to the wrong people about this virus. And I'm amazed to hear people saying, well, I heard an athlete say, don't get vaccinated. Please, let's understand when we're talking to Dr. First, to a Dr. Gath, to a Stephen Williams, to a Letitia Montgomery, these are scientists, these are experts. We've got to put our trust and our confidence in those who prepare themselves and train to give us the best wisdom. So thank you all so very much, and God bless you. To all our NAACP members and our executive committee, we appreciate you for pushing forward to keep us going up higher and healthier. Thank you, Dr. Gath.
Right. Good night to everyone. Thank you all so much for participation. Mask up, vaccine up, and we will talk soon. Take care.
God
Good night.
bless.
Thank you.
How many on?